Hello everyone, this is Dr. Sushma Sarala, consulting homeopath at Fidicus Homeopathy. Now coming into the types and procedures for radiofrequency ablation for the treatment of fibroids. There are three types of radiofrequency ablation methodologies. First one being laparoscopic RFA. So what is laparoscopic RFA? If you are in laparoscopic RFA, I'll be explaining to you through this picture. As you can see, this is the uterus. As you can see here, this is the uterus. Okay. So what they will be doing in laparoscopic procedure, they will punch a hole where they will be sending the laparoscopic ultrasound. Through this, they can view the procedure, the inside of the uterus clearly. And then they will be sending you the probe, that is radiofrequency ablation hand probe or hand piece, wherein it will go inside the fibroid. And the third one is the camera to view it, in all aspects. To view it properly, we need to insert a camera also outside so as to produce a better view. So the laparoscopic ultrasound is pierced to view the inside, and then radiofrequency handpiece is pierced so as to reach your fibroid, and a camera is placed so as to have a better view. And then what will happen? As you can see here in the picture, this is the given fibroid and this is the RFA handpiece. It will pierce the fibroid and it will send heat into the fibroid where it will start to coagulate and shrink. So this is the main purpose, or this is the main procedure how an RFA is done. Now the second type of RFA, which is known as transvaginal RFA. It is usually preferred in women who have already married or who are already married. It is not preferred in women who are unmarried. As you can see here in the picture, in laparoscopic procedure, they will puncture through the abdomen, right? But in transvaginal, they will be sending the instruments through the vaginal orifice. This is usually a preferred method of treatment if you have submucosal fibroid. A submucosal fibroid is a fibroid which is occurring in the uterine cavity or which is occupying the uterine cavity. So as you can see here, it has distorted the uterine cavity as such. So they will reach it through the vaginal orifice, they will pierce the probe, and you can see here there is red color, right, which is they are giving heat to that fibroid so as to decrease or shrink the fibroid. So this is the transvaginal RFA. Viewing the next kind of RFA, which is ultrasonic RFA or ultrasonic guided RFA. As you can see here in the picture, you all know that during pelvic USG, they will be putting a handpiece along with the gel on your stomach and then they will view it in the computer, right? So here, as you can see here, they will be putting the probe on the stomach and then they will be viewing it with the gel, and then wherever there is a fibroid, they will pierce it, and then you can see this red color discoloration, right? All of this red color indicates heat where they have destroyed the fibroids, wherein they have undergone RFA procedure. So this is ultrasonic guided RFA procedure. So there are three types of procedure. All the three types of procedure should undergo these basic steps. What are the basic steps? First step is visualization, that is they have to view where the fibroid is either through laparoscopic procedure or through ultrasound guided procedure. Second thing, they have to target the fibroid. Wherever the fibroid is there, they have to target it by piercing the hand probe or piercing the RFA probe. Then they have to shrink the fibroid through application of heat. And fourth one, recovery. Remember, recovery in RFA is of very less time. That is, you either get the procedure done in the morning and you can be discharged the next day morning. It depends upon the number of fibroids and also the fibroids and the type of RFA that you are being performed. So after the RFA, usually the recovery time is very, very less compared to other forms of treatment. Now let us get into the benefits of RFA, that is radiofrequency ablation for treatment of fibroids. The first and foremost thing is the reason why we are doing is to shrink the fibroid, right? So there is reduction in fibroid size. Second one, there is symptomatic relief, your prolonged bleeding, your menorrhagia conditions, your clots, your severe painful menstruation, the bearing down sensation, all of this can be controlled or regulated or can decrease after RFA. And then uterus preservation, the uterus will be preserved after RFA. There is no taking out of the uterus or surgical removal of the uterus involved in RFA. And also the fourth one is it is very, very minimally invasive. So the downtime after the treatment is also very less compared to myolysis or myomectomy or hysterectomy or UAE. If you're someone who's suffering from fibroids or endometriosis or adenomyosis or polycystic ovaries or dysmenorrhea or PID, remember that Fidicus Homeopathy is the best way to cure all of this. We have two types of consultations here at Fidicus Homeopathy. One is the online option and second is the offline or the in-person option. If you're someone who's staying near the nearest branch of Fidicus, you can come and contact us in person. If you're someone who's seeing this video and are far away from us, you can contact us online through audio consultation options or through video consultation options. Once the procedure is done and once the case is taken, we will be asking you for investigations, and any sort of already done investigations can be shared with us. After the whole procedure is done, especially to our online clients, we will be delivering you our medication. If you're staying in India, it can take 3 to 4 business days. If you're staying in USA, it can take 3 to 5 business days. Anywhere across the globe, it can take 4 to 8 business days for our medicines to reach your doorstep. If you would like to get in touch with us, you can call us on this number, WhatsApp us or messages. And if you would like to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. If you're someone who's suffering from female reproductive organ diseases, it can be fibroids, endometriosis, adenomyosis, PID, dysmenorrhea, polycystic ovaries, remember that Fidicus Homeopathy is the best way to choose your cure, because Fidicus Homeopathy stands for highest chance of health. Here we surely follow 3 principles. The first one is having highest success rate in already treating the existing disorders related to the female reproductive system. We have good number of cases where the outcome is very good and the recurrence rate has decreased. And also we have transparent treatment principle wherein there is no gray area between the patient and the doctor. We will be discussing it with you about the prognosis of the case. And third is the personal care here at Fidicus is top notch. If you have any sort of misunderstandings or queries related to your problem, they will all be clarified. If you want to choose health, if you want to choose cure, choose Fidicus Homeopathy. Thank you.
Fidicus Homeopathy.